Hi, I'm Finn. Today I'm going to talk about a robot that is currently being developed in medicine area. And I will divide my presentation into three parts. First, I will talk about introduce the robot, explain how it works and what it's used for. Second, I will talk about how this machine can benefit human. And finally, I will talk about the possible problem from developing this kind of machine. And let's get started. Let me introduce about the robot. Surgeons are trained to be precise and effective. Their work demands they stay alert and perform to be best of their ability. Because when they make mistake, the lives may at stake. But what if they have some help? So scientists develop a smart tissue autonomous robot, also called STAR, which can perform better at cutting soft tissue and stitch it up than experienced surgeon. Human may leave the ideal cut line because of the tiredness or just sneeze. And if doctor miss one suture, for example, they may create a leak or cause problems. The devices can prevent this from happening because it can perform this task precisely and without errors each and every time. And the devices has 3D vision, infrared light, and force sensing and sub-millimeter positioning to ensure the devices can determine the ideal cut line. And next, I will talk about how the machine can benefit human. The most important skill is tumor removal. Early testing in pig tissue has shown that STAR can remove tumors and cut tissue as precisely as surgeon can. And the crucial skill because leaving even a few tumor cells behind could allow the cancer to return. Doctor said you have to be incredibly precise so you don't leave tumor behind or cut any of the healthy tissue. Surgeon, and finally about the possible problem. Surgeons are still much better than robots at weighting their past experience to make complete surgical judgment, such as what to do when a blood vessel is in different place than the doctor expects. The surgeon can do better than a robot did. And moreover, the system isn't ready to enter emergency because the experiment conducted were performed under tightly controlled conditions. Doctor pointed out that the failure rate for those sort of surgical procedure is less than 1% when not using robotic surgeons. So the sample size is not large enough to prove the STAR can do better than surgeon did. It's all of my sharing. Thank you for listening today. Bye bye.